Welcome again to another episode of our Secure Dental Podcast, where we bring great individuals from different areas of dentistry into this podcast platform. And today we are joined by Dr. Youngsam Kim from Korea. It's an honor to have this gentleman here because he is world-renowned. And Dr. Kim is a prominent instructor on wisdom tooth extraction and dental implant surgery. So with this gentleman here, his credential outspeaks him, and I can go on. And without further ado, I would like to pass it to Dr. Kim. And I am joined here by our great associate, Dr. Daniel Kang, who has been extensively trained under Dr. Kim in the implant surgery department. So he is there right now, and we are joined live from Mexico. And both of them are actually getting it done, getting the implant training and extensive surgical procedures done down there. So with that being said, Dr. Kim, welcome. Let's get started.
Okay, thank you. Yeah, thank you for inviting me. Yeah.
So tell us a little bit about how you got started. I mean, that is a lot of training, a lot of surgical procedures, and a lot of hard work that you did. We would like to know how you got started.
좀 이렇게 나는 그 이빨이 되게 이빨 깎는 걸 되게 싫어해가지고 충치 치료하고 이빨 깎고 그 크라운 프랩하고 이러는 걸 너무 싫어해가지고 서저리를 시작했다.
So he actually started doing the surgery because he doesn't like doing those fillings or the crown works. And then his main focus was more like on the surgery stuff rather than those restoration stuff. So that's why he eventually started in the first place.
This is great because a lot of times we find individuals once they graduate from dental school, they find their niche there, right? Somebody likes endo, somebody likes ortho. And if somebody likes implant, there is no specialty. So what he's done is he's created this niche of dentistry, and many people are just following this path. And I love the fact that he's doing this and he's opening up doorways for many young dentists. So I really honor him for that part. What year did he graduate from, Dr. Kim? What year did you graduate from dental school?
2000, I don't know, 2000 or 한국은 좀 작잖아. 1999.
1990.
Wow. And then from there, was it something where you just figured out you want to do just implants, or was it you worked as a general dentist?
일반 치과 의사로 일을 했지. 10년 전까지는 엔도도 하고 크라운도 하고 다 했다고. 졸업하고 15년은.
So after the graduation, for 15 years, he kept doing those crowns, restoration, stuff. But it was about 15 years ago that he started to transition to those surgery stuff.
Oh, excellent. And as far
많이 했지.
네?
그래도 서저리를 요즘 위주로 했지.
But within those 15 years, he kept doing those crowns and restoration, but for those times, he was more focused on the surgery stuff as well.
Gotcha. You know, I always like the fact that if anybody who's starting and they have a passion for something, and when they take that passion and they create it, they make a career out of it, they are always the best at the field at that time because it's passion that's driving them, right?
선생님이 약간 이제 그 지역 이제 서지컬한 임플란트 그런 환경에서 이제 선구자셔가지고 이제 다른 분들이 많이 도움을 받는다고 이야기를 하시네요.
과찬이시죠.
So what were some of the challenges? Because a lot of times, audience, they like to hear some of the challenges that you went through to get to the level that you are right now. And how was the path? Was it very easy or was it very bumpy?
사랑니 발치 강의를 먼저 했는데 그거는 이제 아무래도 GP가 그런 강의하는 것에 대한 거부감이 많이 컸지 사람들이.
So when he first started, it wasn't so easy because he's a general dentist, but people weren't really nice to him because he's a general dentist teaching these surgical extractions, surgical implants. So in the first place, that was some of the challenges that he had.
And what about when did he started with the academic portion?
10년 된 것 같아요. 10 years? Yeah.
And about 10 years ago, he started.
Wow. As a business and entrepreneur myself, I can understand some of the challenges that he went through because Dr. Kim, it's not easy for you to go through so much stuff and still pass through all the noise. So as far as the training is concerned, let's talk a little bit about the training. Before we dive into that, right? Let's move one step back. Are you still practicing? Are you still practicing besides training other dentists?
치과에서 지금은 이제 아무래도 계속 내가 프랙티스를 해야만 강의가 살아있는 강의가 되기 때문에 한다. 안 그러면 은퇴한 교수님 같은 그런 강의가 되잖아, 그죠?
So he is still practicing in Korea about the dentistry only because he wants to make his lectures live and alive. Because he doesn't want to become like one of those retired dentists teaching those old stuff. It's not going to be really practical and clinical.
That is so huge. That is so huge.
My skill is improving now.
That is great, Dr. Kim. Because, one of the things that I've always learned was learn from the best who's actually still doing it.
Mm-hmm.
And because you are doing it, I think that is like a huge plus, because a lot of times there's many gurus out there who are actually teaching, right? But they're not practicing. And you practicing, I think that shows a lot of dedication.
Yeah.
And then teaching makes me improve my skill again. Yeah.
Yes, because I like also the fact, see, one thing is you're practicing, one thing is you're teaching. And when you teach, you're taking your knowledge, you're passing it on to the young dentist. So many times people who actually learn something, they want to be selfish. They don't want to pass it along. So what you're doing is, I think it's marvelous at helping out many people. So as far as your teaching is concerned, do you teach like all over the world? I see you come here, twice a year or 3 times a year in the United States?
More than
that? Okay. Wow.
6 and I understood 8 times. Yeah.
8 times.
I stayed half of my year. Yeah. I had the 11 times live surgery course in Tijuana in this year.
Wow.
11 times.
So Dr. Kim, besides United States, where else do you travel to teach courses?
연말 연초에는 세미나가 별로 없기 때문에 한국에 있다.
So in the beginning of the year and end of the year, he's mostly in Korea.
Okay.
During the other times, he's in other countries. And 어떤 나라들 가시나요? 여쭤보시네요.
Next year, Japan and New Zealand, Australia, Singapore.
Wow.
Mongolia and Canadian, USA, Deutschland, Italian, England, and Norway.
Wow. That's very impressive.
지금 잡힌 것만.
So those nations are only the ones that are confirmed now. There might be more in the future.
I'm sure.
For the next year.
So, Dr. Kim, what is it that passionates you with teaching and learning? What is the engine? What is the motive? What is the what do you call it? The drive force behind it, the why behind like what you like to do. I can see passion. I can sense a lot of passion in you. What do you attribute your success and your why to when you're teaching all around the world? Because many people would not want to do even one country, and yet alone you're doing so many countries.
Dentist review.
Okay.
나는 수강생들의 후기가 좋아서 다니는 거지.
He's actually doing it because all the reviews from the students are actually pretty nice. And it's kind of motivating him.
지금은 스튜던트의 그런 뭐라고 그러지? 난 지금 한국 치과도 치과 의사들 가족 때문에 돌아가고 있을 정도로 치과 의사들 가족 환자가 많아.
So mostly his patients in Korea are not actually just any people, but they're like family members of the dentist, like father, mother. So most of his patients pools are those kind of people.
Wow.
So it's a competition. Yeah. Korea's implant competition is fierce. It's terrible.
Yeah.
But my implant price is a little bit higher than other dentists.
Okay.
That's why half of my implant patient is a dentist
family. Yeah. So you are the VIP. You are the VIP dentist.
Too many dentists introduce their parents to me. Yeah. That's why I love dentists.
Right. So you said that there's a lot of challenges and there's a lot of competition in Korea, right? I'm going to go back to the challenges. So how bad or how difficult was it for you to rise above the noise?
한국에서 요즘은 GP가 임플란트 세미나 하는 사람은 많아. 근데 사랑니 세미나 하는 사람은 전 세계적으로 서전을 통틀어서도 나밖에 없는 것 같아, 거의. 그래서 막 그런 시기 질투가 되게 많지.
He's actually very renowned in the wisdom teeth extraction. There are many GPs, holding implant seminars and stuff, but the Dr. Kim is like not the only, but the most renowned and kind of like the only lecturer who does the wisdom teeth extraction. So that's how he was able to go through the noise. But then at the same time, more he went up. People just getting more noises. So he's just trying to go through those right now.
I think he's doing a marvelous job
Exactly.
doing it.
그래서 이제 사람들한테 다들 안 믿기 때문에 그래서 병원에 섀도잉 오는 사람들이 되게 많죠. 1년에 수백 명이 섀도잉으로 와요.
So it's funny because he's very renowned in wisdom teeth extraction, but still there are a lot of people who don't believe him. So
Of course.
Exactly. So actually there are very many dentists who wants to shadow him in Korea. So there's at least 200 to 300 dentists shadowing him in Korea every year.
Wow.
To witness it.
That's impressive. And see, here's the thing. You cannot satisfy everyone, right? Yeah. You always take the followers and the lead people who are actually part of your group, and you take them and you run with it. And I think, Dr. Kim, you've done a marvelous job, what you've been doing. So let's fast forward to current situation, right? You guys are in Mexico. Now, so what's going on over there?
So right now, Dr. Kim's teaching us about the wisdom teeth extraction. And so if we get the patients, we also place implants. Yesterday, I placed 2 implants and I did some wisdom teeth extraction.
Nice.
And all the wisdom teeth extraction that we're learning right now, they're not like this or like 4-7 like that. No, they're like more like this with the impection like this. Okay. So right now, he's teaching us about how to section properly, where to protection, how far we should go, and how to angulate the stuff. More like the practical and the clinical aspects of the wisdom teeth extraction right now.
Great.
It's a trial course for the extracting wisdom tooth. 그러니까 사랑니 뽑는 코스는 환자 수급을 하기가 어렵기 때문에 시범적으로 환자들을 어떻게 조달해야 될지 그걸 위해서 트라이얼 코스를 만들어 본 것이다.
So as of right now, he usually most of his courses are the implant courses.
Okay.
Only because it's actually kind of hard to get those wisdom teeth extraction patients.
Sure.
As of right now, this course majorly focuses on the wisdom teeth extraction and it's like a trial course. He just wants to see how well we can collect those patients for the future courses. So that's what we're majorly focusing right now.
그리고 수강생들이 하루에 얼마나 사랑니를 빼고 그 얼마나 동안 뺄 수 있는지도 또 보려고 한 거예요.
And also from this course, he also wants to see how long it's going to be taking for each student to be taking. So he wants to have some average time, some nice data, so that he can prepare very nicely for the next event as well.
Very nice, very nice. So you've been currently with Dr. Kim for about 2 years, 2.5, 3 years?
For me, yeah, I started going to his lectures since when I was in 3rd year in dental school.
Okay.
So yes, it has been about 2-3 years since I know him.
This course? Life skill course?
아니요, in general. 선생님 얼마큼 알았나 제가.
얼마나 알았냐고?
Nice. So how did you hear about Dr. Kim in 3rd year?
In the 3rd year, how I heard about Dr. Kim? Well, I have my brother, Dr. Kang. He's he is my older brother. He doesn't lie to me much.
You resemble your brother in screen.
And when he gives me advices, it's actually those really good advices that he had to go through the trial and error.
Yeah.
So that's why I believe him. First time he went to Dr. Kim's lecture, and I didn't know about Dr. Kim back then, to be honest.
Sure.
But then my brother, he told me that he's a great guy I should learn from, because he went to his live surgery course. And then right after, he knew how to place an implants. So I was like, how'd you do it? I want to place implants too. But how should I learn it? I want to learn the proper way. And my brother told me, you should go to Dr. Kim's course. It's great. You go once. After that, you'll know how to place implants. And I was like, I didn't believe it. I didn't know Dr. Kim, to be honest. I'm sorry, Dr. Kim, but
right.
They said
that's great.
Yeah, they said he's a celebrity, but I didn't really care much about it. But But I went there, and it's not just me, but everyone who went to his implant course, by the end of the course, they were all able to place very nice implants. And it was shocking to me. It was shocking to the other people, and it was shocking to other faculty members as well. So since then, I kind of had built my trust in Dr. Kim, and I
Sure.
just kept going to his courses and more. Every time I go, I learn more. It's just very awesome.
That's such a great honor because here's my thing. I think Dr. Kim, what he's accomplished is through his passion and his love for implant dentistry. Because anytime like myself, I like to mentor my doctors, right? I do it with passion.
Mhm.
And I can see that passion in Dr. Kim. So when he does it with passion, it's going to be a great, great success. Now, so since you are there right now and you've almost done, right? Almost done for the course?
So you're going to be done in tomorrow.
Tomorrow, okay. So on a scale of 1 to 10, 10 being like really confident, what do you feel like after this course?
After this course, are we talking about the wisdom teeth extraction?
Yes, the wisdom tooth extraction.
Yes. So as of right now, I'm pretty confident in the wisdom teeth extraction, but not the impacted one, because those
Okay.
are really hard.
That's fair.
Exactly. So
It takes some experience.
exactly. So before this, attending to this seminar, my confidence in the impacted wisdom teeth extraction would be like, with all honesty, I'd say 3.
Yeah.
But as of yesterday, I learned a lot. So as of right now, my confidence kind of doubled up to 5.6.
Okay.
And I'm pretty sure at the end of this course, it's going to go up to 7, 8. Then,
Sure.
in order to reach it to 10, I'll have to practice by myself.
You have to practice. Yes, yes. So Dr. Kim, what do you think about people coming out of your course? How important is practice?
나는 욕심을 버리고 쉬운 것부터 하되 늘 꾸준히 해야 된다라고 생각한다. 시작은 일찍 하되 꾸준히 하는 게
Yes.
제일 중요하다고 생각한다.
What he thinks is that it's very important to start early, slowly,
Okay.
And
but
steady.
safely.
And safely. I love that.
That you don't
Love
want
that.
to like go like very fast, but then at the same time, you don't want to start late as well. Earlier you start, better it is, because he told me that you got to improve your views, your perspective. You got to know what's good implant, what is not good implant. So that's why you want to start early as well.
That's such a good point. For me, one of the reasons I wanted Dr. Kim on my podcast was because I saw Dr. Ru, I saw Dr. Kim, like previous Kim I had, then I had your brother, then we had 2 other doctors who went to Dr. Kim, your course, and they were very, very, like impressed, right? So if I can attest to so many of my doctors just having just positive 5-star reviews for you, I think, you are doing something right. And I feel like, this is going to be helping out so many more new doctors coming along the way. So as a D4 coming out of school, Dr. Kim, what is your biggest advice for them who are wanting to learn dentistry? They have to learn how the basic dentistry, like the crown and fillings, but at the same time, they also want to do implants. What is your advice for them?
내가 우리 학교에 계시는 분들을 나쁘게 폄하하는 건 아니지만 정말 많은 사람들의 견해가 있잖아, 치과계에는. 그러니까 학교에서 배운 거 말고도 밖에 다른 사람들의 어떤 강의나 다른 사람들의 티칭하는 것에 대해서 들어볼 필요가 있다. 그리고 왜냐면 꼭 자기가 학교에서 하는 방법이 꼭 자기랑 안 맞는 방법일 수도 있으니까 꼭 다른 사람들의 강의를 많이 들어보는 거를, 다양한 견해를 들어보고 자기한테 맞는 거를 고르는 거를 추천한다고.
So he doesn't want to insult the school, but time to time, all for the D4s, you need to learn from the outside of the school. Only
Mhm.
because
I agree.
Exactly.
100%.
The school stuff, it might not be right for you. Exactly. There are many techniques, many faculties, many teachers, and you need to find which one's right for you. It's not necessarily the school's teaching that might be right for you. It might be, it might not be. So it's always better to have as many learning options as possible. So
For sure.
he recommends the students to visit the other lectures outside of school as well.
I completely agree because here's my take on school. School is great, but many times the faculties are there just teaching and they're not in the real world actually doing it, right? So they're out of practice. Not saying everybody, but most of them, right? And most of these guys, they have like their techniques are very, very old and it does not apply to the new age at all. So one thing I really respect Dr. Kim is that he is actually practicing and he is always advancing and he is learning himself, right? He's learning and then he's passing on the knowledge. So it's like he's not only doing research, but he's also doing trial and error, and he's taking everything that he's learning and he's providing the best outcome that, it can help other people. So I completely agree with him. The school may not be the best education in terms of implants and trying to get that experience, but I feel like he's 100% spot on that you have to learn outside school for sure. 100%. So last question, Dr. Kim, what is the future of GIA?
미국의 전 세계 치과 의사들, 또 미국 또는 한국의 전 세계 치과 의사들이 내가 지금은 돌아다니고 있는데 사람들이 와서 직접 강의를 들을 수 있는 그런 강의장을 만들고 싶다. 그게 지금 나의 저기다.
But as of right now, he's traveling all around the world to teach the people. But eventually, he wants to have this one stable place where people can gather up, people can visit and learn about the dentistry. So as of right now, that's the goal of the GIA and also Dr. Kim as well.
그리고 I have one more mission. Yeah?
Yes.
나의 그 강의가 주로 세 가지로 구성이 되어 있는데 하나가 위즈덤 투스, 그다음에 세컨이 임플란트 시어리, 마스터링 임플란트, 그다음에 두 번째가 임플란트 클리니컬 버전이 있는데 이 임플란트 클리니컬 버전이 내 강의 중에서 제일 인기가 많은데 그것만 아직 책이 없다. 그래서 올 겨울에 그 책을 완성하겠다.
So as of right now, he wrote the book for the wisdom teeth extraction and the clinical aspect of the implant.
Mm-hmm.
But then so as of right now, he has 3 topics about his lectures. One is the wisdom teeth extraction. The other one is the clinical aspect of the extraction. And the other one is mastering the implant. He does have the books for the wisdom teeth extraction and the clinical aspect of the implant.
No. Mastering implant.
Mastering implant, but he doesn't have the book for the clinical aspect. So right now, one of his goals is to write the book for the clinical aspect for the implant as well by the winter as well.
As clinical aspect of implant is my best topic for the student. Yeah, that's
Wow.
why. Yeah, I'm writing my third book.
So he is a clinician and the academician at the same time.
I love it. Very few people like that, right? Most of them are academic or clinicians, but you are both. Dr. Kim, it was such an honor. I would really, really love to collaborate with you if you ever wanted to do something in the United States, for any kind of implant base that you are seeking. So if I can be of any assistance, definitely reach out, let me know. It would be a great pleasure and a great honor. At the same time, where can people find you? And if there is some sort of a link, we can definitely post it. Dr. Kang, you can give us a link.
Yeah, of course.
Right. So yeah. And any of your books, any of your books where people can reach out and maybe even get a hold of your course, your amazing course. We definitely would like to reach that out as well.
Perfect.
So, Dr. Kim, with that being said, is there any last minute statement or anything you would like to make before we end?
제 인스타그램을 좀 많이 팔로우해 주세요. 저기가 많이 있습니다. 영삼킴 DDS, YOUNGSAMKIM DDS.
DDS. Okay.
So most of his courses and all the information are on his Instagram. So make sure to follow his Instagram.
Instagram is Youngsam Kim DDS, right?
Yes.
Good. We'll definitely put the link down. We'll put the link in there, and so people can follow you. I will start following you. And it was a great pleasure having you and having you too, Dr. Kang. Thank you very much. Well, this brings us to our last part of our Secure Dental podcast. Make sure you like and subscribe. We will see you guys at the next episode. Thank you again.
Take care. Thank you.